Hi, we're doing a prehab physical therapy visit with Patrick today. He's scheduled for a total hip replacement. And I've already done his subjective intake, his medical history, as well as functional questionnaires. And we're getting ready to start his home assessment. So go ahead and show me when you get out of your car what your entryway looks like.
All right, so car.
That's quite a bit of stairs. That looks like about 12 stairs with one rail. Okay, so what you'll do when you get home, the person bringing you home will stand on your right side. You'll hold the rail with your left hand, and then you're going to go up. As you approach the stairs, you're going to go up with your left leg. So put your left foot on the step, raise your body up, and put your right foot right next to your left leg. And then repeat that. Yes, that's how you'll do it. That way you're not putting pressure down through that right leg. Your left leg is doing all of the work. Okay?
I got hit by a car when I was 20, and I got to wear a splint and use crutches for 3 months.
So
I had to walk with this upstairs for a long time.
So you know how to do that. Excellent. Now, when you get to this point, it looks like it's a sidewalk and nothing to hold on to. So that's where she would hand you your walker. So she would carry your walker up the stairs. She'd place the walker down right there and allow you to walk all the way to those other steps. There's 3 steps with no rail into the house. Okay.
Right.
So at this point, she would take the walker from you again, and you could... You can set the walker sideways to place part of it on the step to use it as a little bit of balancing. I'm going to send you a video on how to go up the stairs using a walker that's been folded. Okay?
Okay.
All right. And then there you go, just right into the house. Perfect. And then if you will take me towards your bathroom area, I can check out your shower and also your toilet.
Okay.
So currently you don't have any trouble standing up from your toilet?
I mean, it aches. It hurts sometimes. I mean,
Yeah.
sometimes it hurts real bad, and sometimes it doesn't.
Yeah, and with you being 6'3", you're pretty tall. Okay, so it looks like you have a counter there that you can hold with your left hand to help you push up. Perfect.
Yes.
And you have a walk-in shower. Excellent.
Do I need a seat, or I'll be okay standing?
You
I don't really have much.
You should be okay standing. Is that a non-skid surface on the bathroom floor there in the shower?
It's good to the top.
Okay, great. Yep. No, you should be fine standing in the shower. If you're not, if you're getting lightheaded or dizzy or anything like that after surgery in the shower, then you can place something in there. A lot of people will just use one of those cheap white lawn chairs from outside that has the arms.
Oh.
Yeah. Anything that's waterproof, you can sit in there. Yeah, and
Right.
it doesn't look like you're going to have any trouble getting up off that toilet because you have that counter on the left that you can help push from there. So, how about your bed? Is your bed super high, or is it a standard?
Well, I've been told that you sleep in a chair, so do I sleep in bed? I mean, I don't care.
I would sleep in bed. Typically, you would sleep in a recliner, like after your shoulder surgeries. The recliner was for that, but I would sleep in the bed after surgery.
Okay.
Yeah.
Yeah, no bed's really too tall for me.
Yes, because you're pretty tall. Yeah. So it looks like you're not going to have any difficulty getting in and out of that bed.
No.
Okay. Okay. And now we're going to start with the functional assessment. So Patrick, I'd like for you to stand fully for 5 times, and I'm going to time it. 1. Okay, go ahead. 2. 3.
I feel the right side for sure.
Feeling it. 4. 5, and sit. Okay. Very good. That took you 15 seconds. And you did not use your upper body. So our goal with that is to get you down to about 13 seconds or less after surgery and after your rehab. Okay, and that's just a measure of your balance and your strength. All right. Yeah.
Felt like the right was good now,
So you did feel increased pain in the right hip with that?
yes, by the 5th or 6th, I can feel it every time.
Okay. Now I'd like for you to do, you're going to stand up. Just a moment, I'm going to start the clock in a minute. Okay. And I'm going to have you walk 10 feet, turn around, come back and sit down. And you make up. There you go.
Turning hurts too.
The turning hurts? And it looked like you had a little bit of a limp there on that right leg.
Yes, I've been having that problem lately.
Okay.
Trying to get a new walk to help that.
Okay, we will definitely work on that. All right, okay, now we're going to go through his home exercise program. So I'm going to share my screen with you, and I'm going to use some exercise videos. I'm just going to go over this one here with you. Can you see my screen?
No.
Okay, let's see. Let me go back, screen share. Might take you a second to see it.
That's fine. Something's changing.
Okay, tell me when you can.
It's bitty, but it'll work. Okay, so I need to lay on my back?
You're going to be laying on your back. The video might say on the floor, but I would prefer you to do all your exercises on the bed. Okay? So I'm going to show you the video, and this is what when I email all your exercises to you, this is what it's going to look like on the screen for you.
Begin lying on your back with your legs straight. Slowly slide one heel on the floor toward your buttocks until you feel a stretch in your knee or upper leg. Then slide it back out and repeat.
Okay. Okay. And on this MedBridge program that I'm going to be sending you, I've also attached videos on going up and down the stairs with a walker and a cane, getting out of the car with a walker after surgery, how to transfer from a chair, from a bed, from a toilet with a walker, and also there's a video on pain management and proper elevation of your leg after surgery. So your therapist will come to see you the day after you get home from surgery and get you started on your therapy. Typically we see the hip replacements twice a week for about 3 weeks, so a total of 6 visits. Some people need less and some people need more. It just depends on their prior level of function and their response to therapy. I anticipate you're going to do really well.
Back Tuesday or like Wednesday the first week, should I try to walk all day in the house, or do I just walk a few minutes?
Because I would get up and walk every 2 hours. That'll help keep.
Okay.
That'll help with constipation, preventing a blood clot, as well as keeping that joint moving so that it doesn't stiffen up on you. It'll help to improve your function. Stay on the walker until your home therapist graduates you to a cane. Do you happen to have a cane?
No.
Okay. You can get these like in any drugstore, pharmacy area. I would just get a single point cane at the bottom, and then it's just a lightweight aluminum, and that's something that you may graduate to. You may not even go to the cane. I don't know how well you're going to progress.
Get one of those cool wood ones with the hook, you know.
No, you don't want to. You can get whatever you want, but I recommend the aluminum adjustable one so it can be adjusted for your height.
Okay.
Yeah.
I guess I won't be getting it out unless I go get it today. Where should it be at on height-wise? What should I have the cane?
Well, your therapist will definitely adjust that for you, but typically we want, as you have the cane in your hand, we want your elbow a little bit bent, like that.
Okay.
So, and as I place my hand down by my side, the cane handle is at my wrist joint.
Okay, wrist joint.
Yeah,
Gotcha.
at the wrist joint. And yeah, and then they'll show you the proper technique for using a cane as well. Most people will keep it in the wrong hand. You always want it in the hand opposite your surgery leg.
I was already practicing using my right hand.
Yeah. So you want it in the opposite side. That will keep your gait in a proper alignment. Otherwise, you tend to lean toward it. This prehab session also included education on incisional care, signs and symptoms of infection and DVT, demonstration of the use of the polar cube ice, and a discussion on pain management. Thanks for watching.